Good afternoon, everybody, and welcome to our CCE Consumer Office Hours to address questions that you may have or that you may be receiving from your communities related to COVID-19 and the food industry. So we're going to kick things off here, just some basic housekeeping. We will be recording this and we'll be posting it on our website. And in order to unmute yourself when it comes time for question and answer, you can unmute on the computer or press *6 on your telephone, or you can always ask questions on your computer in the chat box. So feel free to utilize these. We did get some of the questions that you had when you registered for this. You submitted some questions that you already had. So we will be covering those first, and then we will open it up in general. Next slide. So to kick things off, we do have some great subject matter experts on today's call. We have Dr. Sam Alkane, Dr. Miguel Gomez, Dr. Olga Padilla-Zakor, Dr. Aliosa Turmchich, and Dr. Martin Weidman. And my name is Anika Gianforti, and I'll be moderating for the day. Before we get into questions, I'd like to kick it over to Al, because Al's going to walk through our website resource for you. This is important because it's a great place that you can go if you have questions that you have personally or questions that you have from your community members. It's a great resource to point people to. So Al, over to you.
Yeah, thank you very much, Anika. So Institute of for Food Safety has a webpage on COVID-19. There are several main sections. The first one, food industry. Then we have a section for consumers, some information, background information on the COVID virus, New York State laws and regulations, a section on infographics and posters, podcasts and webinars, and finally information about our office hours. So under food industry resources, we have several different information, just general for the industry. Down to information about what to do when an employee tests positive, social distancing, hand hygiene, and respiratory hygiene. Under resources for specific to commodities, we have specific information for dairy, produce, meat, seafood, restaurants. We have a section, minimize personnel risk, where you can find information about employee rights, information about testing employees. A very important section would be food industry frequently asked questions, where you should find all of the questions, all the answers to your questions that you're looking for. You should find either here or under consumer frequently asked questions. If there's any questions that you need addressed and you cannot find them here, please let us know. We have a section on templates and trainings where you can find all sorts of SOPs, checklists, decision trees that you can use in your training or with people you're working. We give some information for companies that are making hand sanitizers. Under consumer resources, you can find frequently asked questions that are specific to the consumers. Very important section would be infographics and posters. This is something that could really help you to get the message across when you're using it with your employers, or when you're trying to explain some of the issues to other people. Lastly, I would encourage anybody, if you have any comments or questions, to use the contact list on the page to let us know how we can be of help. I think with this, I would finish this short introduction and give my word back to you, Anika. Thank you very much.
Thank you, Al. Okay, so that's a great resource that you can utilize, and I know that we're doing our best to make sure those frequently asked questions are updated so that they're reflecting what questions people currently have. But now we'll get into the questions that you specifically had when you registered. So if we'll go to the first question, Beth. Okay, so one of the questions that we received when you registered was, have the working conditions for meat packing factories improved? And what is being done to make sure that the factory workers and food is being kept safe? So if someone from our panel could address that.
Yeah, I'll jump on that one. Taking a step back with the virus that causes COVID-19, right? We know that it is predominantly spread through, right, close person contact, right? And so when we talk about these meat packing facilities, we kind of had a confluence on both sides, right? We had the conditions within the plant and we had conditions within the community that made it much more easy for, right, this virus to be transferred within the meat packing facilities. Right, workers there work very close to one another over long hours, so it's easy to see that close person-to-person contact happening. And then also for many of those workers in the community, right, where they lived, many would live together, right, in shared housing, in close quarters. And so again, we see these two situations, right, where, right, if say someone in the community at home caught COVID-19, right, they'd be at home, they'd spread it to the other people in their house, and those people would work at the factory at different shifts, maybe at different parts of the plant. And so the virus would be introduced that way. And then also within the facility, if someone came in sick, they would pass it to their coworkers, they would go home, right, and then take it home, and those people could spread. So you could see the cycle back and forth between the plants and the community. And that was kind of the challenge there. Now, as we started to see these plants, start to have these issues really in April, right, was where it really started to spike. CDC has come out with guidelines, and I kind of put it here if you ever want to reference them, for meat processing facilities that really focused on trying to cut down, right, that person-to-person spread. So it was about, finding ways to implement, right, social distancing, which is important for engineering barriers between workers, right? So plastic barriers or things to keep them separated, implementing face coverings to prevent asymptomatic people from spreading the virus, and also implementing, right, employee screening checks, and then also making recommendations for what workers should do in the community. And so there's been a lot done to improve the safety and the factors that could contribute to the spread of the virus among meat processing facilities. It all depends on the individual plant, but we are already seeing a lot of those plants that shut down in April have come back online now. There are still some plants in the news that we see that, that hadn't been affected that are shutting down now, but they are actively working to implement strategies to protect the workers. And I will note it's not just, all right, a meat packing issue. We saw earlier this week that CDC also now has released guidelines for agricultural workers, which also take a lot of the recommendations that were used for the meat packing facilities and kind of focus them on farm and also for the community factors that we have for those type of workers. So there is a lot of work being done to ensure the safety of food workers, whatever the industry that they're in. So.
Sam, we should probably talk about the safety of the food too, because the question, we also covered that area.
Well, yeah, it does kind of mention, are we keeping food safe? And on the food side, right, as Olga's kind of alluding to there, is that we know that based on the epidemiological studies and all the research that has been coming out, that COVID-19 is not readily transmitted through foods. And so there's not a risk of food actually then being a carrier of the virus. So really the main focus is around worker health and protecting that. We don't have to be as concerned of it coming through the food.
All right. Thank you, Sam. And just a reminder to folks, if they have questions pop up, feel free to type them into the chat as we go along, because we will catch up with that. All right, now moving on to our next group of questions. We have been receiving a lot of questions about grocery shopping and food handling during this time. And I think the reason for that is everyone eats and everyone's still going grocery shopping because they need to eat. So with that being said, there's a few questions here that all strike in the same vein. So we'll start out with the first question for the panel. As I leave the grocery store, do I need to sanitize my hands before touching my car door, etc.?
Yeah, Nico, maybe I can jump in. So interesting question. So during shopping, we are touching surfaces that we like to call frequently touched surfaces, just because a lot of people are touching it. There will be like carts and baskets and refrigerator handles. When you type in your PIN for your credit card, some people are still using cash. So when you come out of this environment where you're touching frequently touched surfaces, I would say it's best practice to use a hand sanitizer. So it's a quick fix because you don't have soap and water there. But when you come home, you should put your grocery bags on the floor, wash your hands with soap and water for 20 seconds, come back, put all your groceries away and wash your hands again. You should also wash your hands before you start preparing food and before you start eating the food. If I go back to car question, so you're using hand sanitizer as an extra precaution, just in case if you forget and you start touching your face, because this is actually how you're going to transfer the virus from your hands to where it can actually infect you. So your mouth, your nose, your eyes, because just by having that on your hands, it's not going to infect you. So this is why we're using hand sanitizer. Hand sanitizer is not there to prevent contamination of your car door or interior of your car. Something that people would think maybe it can cause a risk later on when you're using car or somebody else is using your car, because something like this is really, the risk of that is almost non-existent, because just the chain would be too long. You would have to, contaminate your hands in a grocery store, they contaminate the car door, then later on you would contaminate your hands and take that hand to your face. What I think you should worry about is taking that hand immediately as you stop grocery shopping, So the key is don't touch your face, wash your hands regularly, or use hand sanitizer if water and soap are not available. So I think that pretty much would cover. Yeah.
Right. So going along those same lines, why don't we address the glove question while we're talking about hands and touching faces?
Yeah, the gloves. I don't know. I'm not aware that gloves were ever a requirement in supermarkets. I would say that similarly as surgical masks and N95s, gloves are something that's essential for medical workers. And I would stay away from using gloves just so we're not reducing already short supply of these items. Like Sam said, the key is transmission through contaminated surfaces is very low. The main risk is person to person. So risk of transmission of virus from contaminated surfaces is actually very well controlled with use of hand sanitizers. So when you walk into a supermarket or grocery store, use a hand sanitizer to protect people that are in the store. When you walk out, you use it again to protect yourself. Also, hand sanitizer is actually, in my opinion, more effective than use of any gloves. And also a much cheaper option. So I don't think there's a need to use gloves. Maybe some would consider that it could maybe even increase the risk. There's issues like putting on gloves, reusing them, not washing hands, or not using hand sanitizer. So when you're using gloves, you should wash your hands or use a hand sanitizer anyway. So if, I don't know if this person that had a question was using the gloves in supermarket because of the risk of COVID-19. And if the question is the risk of COVID-19 still there? If that's the question, I would say yes, the risk is still there. But gloves are not needed to reduce the risk. I don't think they were ever needed. The key is, again, just the basic. Practice social distancing, wear face covering, don't touch your face, wash your hands, or use hand sanitizer if water and soap are not available. There's no need for gloves.
All right. Thank you, Al. And then the next question we'll jump back up to, should retail and restaurant businesses have a shield barrier between their workers and customers? So I know that some businesses have already implemented these things, and as we move into different phases.
Yeah, I think that that's coming in more and more, and that's another example of, I would say, like best practices. And if the restaurants and retail stores are able to put something like that, like shield barriers, that's something that would greatly reduce the risk. I see this shield barriers as a good temporary replacement of social distancing. So when a consumer comes and pays for the food and takes the food, you know, these are the points when they are breaking that 6 feet distance. It's a good barrier, but I would say it's not an absolute replacement for social distancing. So we should still wear our face coverings. We should still practice social distancing as much as possible. When I say that, that means maximizing the distance between the people. Even if you're not able to maintain that 6 feet, you know, 5 feet is still better than 3 feet. Another point is try to minimize the time you're spending within those 6 feet. And just the general one, you know, try to minimize the time you're spending in retail stores, restaurants, and other indoor kind of public places. But yeah, shield barriers are definitely a good option.
All right, thank you. And then switching gears a little bit in terms of just food handling practices, should I be washing fruits and vegetables as soon as I bring them into the house or before I bring them into my home?
Yeah. Another interesting question. Yeah, I would say the answer would be no. Just wash them before you use them. So when you come home from grocery shopping, you should, again, like wash your hands, put everything away, and then wash your hands again. You know, refrigerate what needs to be refrigerated, put frozen food into the freezer. I know there are some instructions online on, you know, keeping your groceries outside for 3 days just to make sure that the virus is inactivated. Just to make sure, this is really a poor attempt to address a risk that's almost non-existent. But on top of it, it's introducing actually a much higher risk, you know, by leaving your food exposed to like dirt and animals and insects, or not refrigerating food that needs to be refrigerated. So what I would say is when you're ready to prepare your food, wash your hands with soap and water for 20 seconds. That's when you wash your fruits and vegetables under cold water. So wash them before you use them. Then you prepare your food, and again, you wash your hands before you eat it. The very important part is don't use soap or detergent or sanitizer or acids to wash your fruits and vegetables, because you know you can seriously harm yourself by using these chemicals on fruits and vegetables. So if I go back to the question, should you wash like immediately as you walk in? I guess the idea comes from trying to prevent contamination of your refrigerator or storage space with the virus. But I have to say that it's, you know, it's highly unlikely that fruits and vegetables would be contaminated with the viable virus that can actually cause infection. I know it seems like fruits and vegetables are touched all the time, but that's actually not the case, you know. And even if that, you know, potentially infected person does touch the fruits and vegetables, they're not transferring a lot of virus onto the surface of that produce. And even that small amount of virus, you know, just because the virus is so unstable outside of the host, the numbers of viable virus go down fairly quickly. So again, highly unlikely that fruits and vegetables would be contaminated with the virus. So I would say just wash your fruits and vegetables before you use them. Again, wash your hands before preparing the food and before you eat the food. Yeah.
Great. And similar question, but instead of fruits and vegetables focus, this is along the lines of food packaging. So we've gotten a lot of questions on whether or not we need to wipe down, plastic containers of food. So what is the best way to clean up the packaging or foods that are brought home from the store?
Yeah. So you don't have to clean, again, food you're buying, it's highly unlikely that it's contaminated with the virus, Like I said, people are not touching all the food in the stores. Even if potential person is touching it, they're not transferring a lot of virus. And the virus itself, like any virus, needs a living cell to reproduce and survive and exist, And when it comes to coronavirus, just structurally, they're even more sensitive to environmental conditions compared to other viruses. So coronavirus and COVID-19 virus are all inactivated fairly quickly. So I would say you don't need to clean the packaging. You don't need to discard the packaging. When you come home, just put everything away, because food and packaging is very unlikely to be contaminated with the virus. And again, similar as with produce, very important, do not disinfect your packaging. It seems like, well, it doesn't hurt, but you're actually introducing this chemical hazard that can actually harm you much more than any viral kind of risk that you're trying to address there.
All right.
Maybe let me jump quickly on that because I think it's a really important. Yeah, as Al said, the virus is very unstable. It's excessively unlikely to get from the package on your finger, even if it were there, and then from your finger onto your nose, or where it can enter your body and cause disease. Transmission is, by vast majority of transmission, is through droplets, so person-to-person transmission. And we have seen with COVID-19, when this all started, that there have been more calls to poison control centers because people use sanitizer, they mix sanitizer, they create poisonous gases, and then they have to go to the hospital. And your risk of getting COVID-19 is going to be a lot larger if you have to go to the hospital than if you don't, because you inappropriately use sanitizers and created a chemical hazard, than it is, then the risk, the sort of negligible, virtually nil risk that you avoid by sanitizing packaging or sanitizing food. So do not sanitize food packaging, do not sanitize food. The other thing is, even taking out packaging, when you do that, you're going to expose it. Now the food could get contaminated with bacteria, salmonella, E. coli. You create other risks. Again, if you have that disease, then you have to go to the hospital, and then you're more likely to get COVID-19. So it's not, a lot of people are like, well, can it hurt? Well, it can. If you go overboard, you create bigger risks than you avoid. So that's really, really important as we message it to the people we work with and to the consumers we interact with.
Right. And as we're on this section right here, going along those comments, Martin, we got a question in the chat referring to studies that show that the virus could last on surfaces for about 3 days. Why is this not a major concern in the case of food?
Right. So this is one of the big areas of confusion, right? So we'll start out with sort of survival of virus. How long does it survive? Well, survival times are misleading. Why? Because if I put a lot of virus as a starting on a package or on a surface, it will survive longer. If I start with 1 billion viruses, it will survive longer than if I start with 100,000 viruses. So these numbers on saying, oh, the virus survived for 3 days, are really very misleading in most cases, because people would start with extremely high levels of virus that would not be found in a package on a food that would have gotten contaminated, even if someone conceptually sneezed on it. And so these are long day survivals are really very misleading. You sometimes will even see studies that say 10 or 17 days of survival. Very often, or all of those studies are basically more than 3 or 4 days of survival. Would be studies where people actually look at the genetic material of the virus, not the live virus. And so the genetic material can survive much longer than the live virus. So those are also misleading. So the key part here is that these viruses are very unstable. They're what we call enveloped viruses. That means they have sort of a lipid membrane around them, and that's why soap, so detergents very easily inactivate them. They're very easily inactivated in the stomach pH. That's why they're not foodborne. Okay, so very, very important. And then the other thing is typically the viruses will go down by twofold every somewhere around 3 to 7 hours. So if you start with 1,000 viruses, 2 to 3 hours, you go down to 500, then to 250, etc. But we also need to really remember that it's not just about the virus being there. If you have to get sick, the virus needs to be there. Then the virus needs to transfer from the surface on your finger, and that transfer is very, very inefficient. Even on a sort of best of circumstances, smooth surfaces, it's probably less than 1%. So if you were to start with 1,000 viruses, you might get 10 on your finger, but then it doesn't infect you on your finger. Then it needs to transfer from your finger on your mucous membrane, so your nose, typically somewhere in your face in general. And that transfer is very inefficient. Again, probably only 1 out of 100 viruses on your finger will get on those surfaces, unless you pick your wet nose, because transfer is much better when you have wet surfaces. So obviously, don't pick your nose when you're out there. That's the key prevention strategy. So bottom line, virus does not survive well, dies off pretty quickly, very inefficiently transferred from a surface to a finger, and then very inefficiently transferred from a finger to something else. So there's absolutely no evidence, and CDC has come out much stronger, that there's very, very little evidence of transmission through the environment, with the exception of, let's say, ICU units, where you have patients that were intubated, where you have extremely high loads. So, environmental transmission is not what we need to focus on. What we need to focus on is, person-to-person transmission, social distancing, face masks. Those are the key strategies. Wash your hands when you get home. Those basics still apply, but don't go overboard with sanitizers, because you create more risks than you avoid.
All right. Thanks, Martin. Okay, let's jump gears a little bit and move on to some supply chain questions. So these, again, are questions that were all in a similar vein that relate back to why we can't get certain products at certain times. So we can start with the first one. This is a specific example, but why are there limited choices of products? I can only find shredded cheddar and mozzarella, but not Colby. So things like that. Miguel, do you have any insight there?
Yes. Before the pandemic, an average consumer will spend half of his or her budget on food in restaurants and cafeterias, and the other half in supermarkets and grocery stores. So one of the biggest changes in the supply chain is that restaurants all of a sudden closed and all cafeterias closed. So all the demand that used to happen in restaurants shifted to supermarkets. So supermarkets start seeing a huge demand for products, and supermarkets have limited space. Yeah. So, and then we see that, for example, in the case of cheese in particular. So when you have a huge increase in the demand for cheese in particular in the supermarket, and you don't have unlimited space, what happens is that the reaction of the supply chain is so there was a rush to repurpose product that was prepared, packaging, labels, everything for the restaurant industry is different than food supermarkets. So the industry rushes into shift the product, the destination of the product from restaurants to supermarkets. So what happens is that there is a huge increase in the flow of products going to supermarkets. And in that shift, given that you have limited space, the supply chains focus on those products that are more popular, for which demand is higher. So that's, for example, what we are seeing, and you don't have a space to have all the assortment of cheeses. So that's why we are seeing more limited assortment of any product category. in the supermarkets, basically, just because of that shifting demand.
Thank you. And would you say that the same answer applies to that second question? It's hard to find extra large eggs, only medium in the store. And I've seen this come and go.
Yeah, and that, you know, smaller eggs usually go to food service because you don't see the egg, you know, when you are consuming it in a restaurant. And again, you know, all food consumption shifted to supermarkets, so we are preparing more and more meals at home. Therefore, we know in the supermarkets we like the larger eggs better. So they really, whenever they are available in the stores, that's what consumers prefer. Yeah, and because there is so much demand for eggs in the supermarkets, of course, then we once the large or extra large eggs are gone, then consumers are willing to buy the smaller eggs.
And I think this next question hits a little bit of a different side of the supply chain. So the question is, why are they killing the chickens and pigs when we are having a hard time finding meat at the store?
Yeah, here the issue is different because when you think about cheese and dairy and eggs, these are, when product leaves the farm, it's not that labor intensive, the processing and distribution of these products in comparison to meat products. We know that meat packing plants, as Sam was indicating at the beginning, the meat packing plants in the US in particular are extremely labor intensive. And if you think about food products, perhaps the meat category is where you find the highest level of concentration. That means you have a big proportion of the chickens, pigs, and meat beef that we see in the stores are processed in a relatively small number of huge packing plants. And therefore, because in these huge facilities, workers are in close proximity for long time. So it became a focus of the pandemic, and many workers got sick. They had to close some plants. Then when the plants reopened, unions were very reluctant to go back. Then the factories had to change the production lines to allow workers to be in the proper distance, and that reduced the throughput of product, less productivity, less production per day. And then when we see that the problem of not having these huge plants closed was the resulted in many farmers not finding market for the chickens and pigs and livestock, and that's why we have seen stockouts of these products in the store, and again, similar to the other two questions, a much more reduced assortment of products and more expensive.
Right, so different problems along that food supply chain based on the meat example versus the other example. What would you say about the canned vegetable?
So that's a very good question too. The other big trend that we see with this pandemic is that consumers are moving, because another impact of this pandemic is in our incomes. Yeah, so consumers are moving from consumer fancy foods to more basic foods, and also they are moving from consuming products that are highly perishable to things that you can storage for a long time. So that's why we have seen that consumers purchase a lot of rice, beans, and canned vegetables, because you can storage them for a long time. And this was in the psychology of consumers. whenever there is a crisis, the first thing we do is to overbuy, to buy more than we usually do. In some categories, it was even double the amount of purchases by household for a given product. So what is happening is that canned vegetable, because we can storage them in our houses for a long time, we are purchasing a lot of them. And again, because we are not buying food in the restaurants, we are buying more in the supermarkets. And why would they be plowing other vegetables? Because I believe for perishable products, having a supply chain disruption is much more is bad, because the decay of the product is evident after a few days. In comparison, a canned vegetable, a canned product, you can storage for a long time. So that's what we saw, and also in terms of fresh vegetables, also because the restaurants and cafeterias are huge customers of fresh vegetables. When restaurants closed, it wasn't automatically done that producers were able to find markets in the supermarket industry for that product that was originally produced for the restaurant. So that's why at some point we saw vegetables not harvested, and in addition, because it's probably harder to get labor, and in general, vegetable harvest requires labor, and with the restrictions on worker mobility, so some farms there is evidence that that it's hard to get the workers. So that's a big concern from New York agriculture when we start harvesting. Is there a risk of vegetable shortages? No, I don't think we are going to have shortages, but I do believe that we are going to see less assortment, less product variety in the stores. So we will, as consumers, we should be getting used to be able to cook with a less variety of products that we find in the supermarkets.
All right, thank you, Miguel. All right, we're gonna switch gears one more time away from the supply chain questions, and well, not one more time, I shouldn't speak too soon, but are bandanas just as effective and safe as cloth masks? There's been a lot of discussion on different types of masks and what's effective and what's not. So could someone from the panel jump in on this question?
Yeah, so let's start a little bit, I guess, again, with the virus and then the terminology here, right? So again, Martin had mentioned, I kind of mentioned it earlier again, right? And just it doesn't hurt to re-hit the point, is that, right, this virus is, right, primarily spread through person-to-person contact, and that's driven through these respiratory droplets, particularly the bigger droplets, right? The bigger the droplet, the more virus, the smaller the droplets, the less viruses are contained. So it's around really preventing the spread of these larger respiratory droplets. Now, talk about masks. So when we talk about face masks, and you're talking about CDC terminology, when they talk about a mask, a face mask, they're really talking about those N95 masks and those surgical masks, right? We know that N95 masks are very effective, right, at filtering out viruses and small particles, but, right, they're hard to find, and they're really meant to be reserved for healthcare workers who need them. And same with surgical masks, they're not as effective as N95 masks, but they are meant to be saved for healthcare workers. Now, we know that we want to keep some of these respiratory droplets, right, out of the air, right? If you're asymptomatic, they're spread when you talk, when you cough, when you sneeze. And so CDC came out with a recommendation to use cloth face coverings, okay? Now, the challenge with these cloth face coverings is that they can be made of many different types of materials. So when you say cloth, right, bandana could be cloth. It could also be a t-shirt, right? It could be a piece of, right, of another type of cloth, or maybe canvas. There are a lot of different instructions around it. And if you go to the CDC website, which Beth popped up in the chat box, right, you'll see that they have recommendations there on how to make these different types of cloth face coverings, okay? Which includes, right, a section there that talks about how to use bandanas to make cloth face coverings. They also talk about, you know, how you fold these pieces of cloth to make multiple barriers, but really the ability to capture those large droplets really depends on the cloth material itself. And there's not a lot of research out there looking at this. There's been some research looking at how it controls droplet spread. And actually you can find some of those studies linked to on our website, but it's really hard to make that one-to-one comparison, particularly with infectious virus. I don't think I've seen a clear study on that with different types of cloth masks. So they're not perfect, but they do grab those larger droplets, which then helps limit, right, the spread from you to other people. And so, you know, I would basically, if I'm looking at making my own cloth masks, I would follow what is there on the CDC website. They can be made from bananas, they can be made from cloths, but getting into the nitty-gritty details, if I'm using denim versus silk versus something like that, there's not a lot of, unfortunately, not a lot of great data out there to help us make conclusive decisions between them. I would say the main really focus is we're wearing these cloth face coverings, but really social distancing, that distancing of 6 feet is really what's important, right? To also help keep us out of the range of most of those respiratory droplets. So social distancing and any cloth face covering, as long as it's relatively within the lines of CDC, is what I would be using.
And some, I think it's important to add that there should be 2 layers of material. That's the basic recommendation from CDC, that even if you're using bandanas, it has to be 2 layers of material to really be much more effective.
Yeah, and they show you how to fold them in that on the website.
And yeah, the really key point there is there's a lot of people who could be asymptomatic, and the goal of the face covering is to prevent you from contaminating somebody else with that virus. So great points there. Okay, now moving on to survival of the virus. So Martin did address this a little bit earlier based on the question from the chat, but Martin, there's a lot of talk about how the virus may not be able to exist on surfaces. Does this change the need to sanitize on a regular basis?
As I said before, I mean, it does survive for short times on surfaces, but the key part is that it does not transfer very efficiently at all, and that all evidence suggests the transmission from surfaces to humans is not the major issue that we have. And again, this is confusing to people because, you know, early on we heard about meat processing plants shutting down for 14 days of deep cleaning. And it was like, oh my God, this virus must survive on surfaces, like unbelievably, because we need to have 14 days of deep cleaning to get rid of it. That wasn't really 14 days of deep cleaning. It was 14 days because that's the maximum incubation period. We were trying to break one cycle of incubation period, much more than deep cleaning. So I think intuitively people just feel like, you know, surfaces were such a major issue because of some of these headlines, which it is not. So, you know, really not much change in our knowledge on existing on surface, but we realize that just surfaces are not important transmission. Does it change the need to sanitize on a regular basis? Well, as we said, don't sanitize food packaging. Definitely don't use sanitizer to clean your vegetables or your produce, etc. You should still, you know, frequently or sanitize frequently touched surfaces. You know, if you come back from a grocery store, you put your grocery bags on a table, you know, clean and sanitize afterwards. Frequently wash your hands. That's probably a lot more important, particularly when you come back from a grocery store, from being outside in general. So those are the key things. Can COVID-19 survive in the freezer? I think the question probably isn't really whether it survives in the freezer, but whether it survives on frozen products. We gotta say it again. COVID-19 is not foodborne. It is an envelope virus, very easily killed by stomach acid. There's absolutely no evidence that it's transmitted by food through epidemiology. And even, you know, and again, this is confusing because people are like, diarrhea is a symptom. How can it not be foodborne if diarrhea is a symptom? But it appears that the virus spreads through your system, through your blood vessels, and then gets into your intestines after the stomach. So it is not foodborne. So really not a concern about frozen foods. You know, these foods are stored for a long time. So even if this worst case scenario is someone with COVID-19 sneezed on your frozen food package, when it was packaged and you brought it home, the transfer coefficient is very ineffective. So this is not, COVID-19 is not a reason to stay away from frozen products. The risk is no higher than any other product, which is, with all other product, is basically nil from the environment, from the packaging, and definitely as close to nil as any scientist will say for foodborne transmission.
Thanks, Martin. Okay, and then another group of questions that we really frequently get is about takeout and dining. So a lot of these restaurants are staying open by offering takeout services. So how safe are plastic cups from drive-through for food service operations, and should you be spraying them down with disinfectant after you receive that?
I'll be happy to comment on that, Anika. So as Martin already explained, and Sam already explained, really contamination through surfaces, the risk is basically negligible. So plastic cups that come in when we have food service packages, they all come already pre-sterilized with, because when you make a plastic package, you have to fuse the material. So therefore, a tremendous amount of heat is applied to it. They already come in closed packages. They're totally safe. And now we're going to have people that are doing this in a facility where it has been inspected by the health department or Department of Agriculture and Markets. We already have these procedures in place to protect any food that we're producing from regular foodborne contaminants. So having COVID now into the equation doesn't change that dynamic for us. The virus is not transmitted by food, it's not foodborne, and therefore having just a surface like a plastic cup that is given to you, as already explained, the transmission is extremely, extremely low. So please do not spray with a disinfectant, because now we're contaminating the food, your beverage, with the disinfectant that you are going to ingest, and that can make you sick. So the same as we have said before, basically just wear your face mask, the social distances, because the most risk that you're gonna have is the interaction with the person, not with the object or with the food. So that's what we have to keep in mind, that basically the social distancing and providing the face coverings and washing your hands are the most important ways to protect yourself from the virus.
Thank you, Olga. And would you also mind addressing the next couple of questions? So the first one, how safe is it to order takeout food, and is it better to do delivery or pickup?
Really, if you follow the recommendations that we have in the website, it's really not a difference at all. So right now, when you order food and you go and pick it up, the main risk is going to be your interaction when you pick up the food with the person that is really giving you the delivery. But we'll follow the same rules as before. We wash your hands before leaving the house. We go to the pickup station. We wear the face coverings. We try to maintain the social distances. And the exchange of the food, we're gonna be a little bit closer. So basically, you will collect your food. You're going to bring it to the car. If you have a disinfectant wrap, as I already explained, would be good to use it at that point. And when you take the food home, you bring it home, put the food on the floor. That's the best situation that we will have. Take the food out, dispose of the bag, wash your hands, and then you're ready to go. Now, when you have delivery, what we are recommending is that you make sure that there's delivery at your doorstep. Again, trying to minimize the contact with the person. So when you call in advance, pay in advance, tip in advance, so when the person comes to the door, all they have to do is to leave the food there, ring the bell, so there's no interaction with the person. Once they're away from the door, you pick up the food, the same procedures that we discussed before. So really, it's a very safe environment. You just practice these very common sense measures. And the last question we have there is, it is safe to eat sushi? Yes, it is safe to eat sushi. The same as we have explained before, there's no risk for the food. You can have fresh food, you can have sushi, which is high quality raw food that has been properly selected by chefs to be eaten as a sushi product. And I would certainly think that you should enjoy the food, and there is really basically no risk at that stage.
All right, thank you, Olga. So at this point, those were most of the questions that we had when you submitted questions upon registration. Now I'd like to open it up. We've got about 5 minutes where we could take some additional questions from the audience. So feel free to unmute yourself or type in the chat box. Give everyone a couple moments. Another thing that I'd like to mention, and Beth has done a great job at posting a lot of links to what we were covering. I do want to mention that there's some great resources on the infographics page of the website that was linked directly to you in the chat. So please feel free to use those and share those with your own communities as well. Any questions from the audience?
Yeah, I have a quick question.
Go right ahead.
This is Phil Warner, Cornell, New York City. Cornell Cooperative Extension, New York City. Just a quick question. Maybe I covered it already, but now that we're going to be having extended daylight hours, sunsets at about 9 at this part of the world, sunsets about 9:30 p.m. Is the ultraviolet rays? Is any indication? I know that organisms are temperature specific. But on this particular virus, are there any evidence that the ultraviolet rays of the sun is going to have any detrimental effect on the virus? We see some indication of that in the Caribbean, but we don't know if that is true or not. But does anybody have any information on that?
So this is Martin. I'm going to give it a first stab. UV light, if directly put on a virus under very controlled conditions, will lead to some reductions. But from a sort of in a real world environment, extended sunlight is not going to do much at reducing the transmission of COVID-19 because, again, surfaces aren't the big issue. It's mainly it's person to person through these droplets. There's this sort of, again, so the intuitive part is like, well, the flu happens more in the winter. Why is that? Versus in the summers, it must be the UV light, which is actually, from my understanding, only potentially part of the story, not the real story. The droplets you create are actually very different in different humidities. So you're going to create droplets that transmit better in the winter, typically, when plus, people are closer together in the winter. So I think, the whole idea that, in the summer it will go down, I would not hang my hat on it. It's going down because we're practicing social distancing. But as soon as we let off on that too much, we're gonna, see numbers go up again. So I think we gotta be very, very careful that people don't believe, it's sunlight from 5:30 to 9:30. So we don't need to worry about it much anymore, and we'll let their guards down with regard to social distancing.
So thank you everyone for joining us today, and please feel free to reach out to us via our website or individually with any questions that you may have. Thank you all and have a great rest of your day.